I hope you can see there is a flashback in the jump of the cannula. Then what you do, you pull back the needle slowly. So you will experience a secondary flashback. Then you advance the cannula deep into the vein. You release the TNQ. Then you remove the cap of the cannula. Then what you do, you apply pressure on the tip of the vein. You completely remove the needle. Then you cap the cannula now. Then what you do, you start dressing the cannula now. You get the adhesive tape. So this is how you are going to dress the cannula. Hi there, welcome back. In today's video. In this episode, I'm going to demonstrate how you can simply perform IV cannulation technique. So before you start, make sure you gather all the necessary equipment that you need to perform the procedure. For instance, you may need adhesive tape for you to dress the cannula. You will need an alcohol swabs for you to clean the vein. You will need a needle together with a syringe. You will need a cotton wool. You will need IV cannulation on gauge 22 or 24 gauge cannula, depending on the size of the vein on which you're going to perform the IV insertion. You will need examination gloves for you to use at a TNQ. You will need an hand sanitizer for you to clean your hands. So before you start, make sure you clean your hands first. Make sure you sanitize your hand first. Then what you do, you get a gloves, you use it at a TNQ. So before you start, make sure you introduce yourself to the patient, you explain the procedure to the patient, you gain consent to continue. Let us proceed. So you get the patient's hand, make sure you apply a TNQ first. So what do you do whenever you are performing IV cannulation? Make sure you do a lot of retraction for the vein to be feasible for you. And mistake to avoid for you is that whenever you are inserting the cannula deep into the vein, make sure you have to retract back the skin for the vein not to move from side to side, you can see. But if you don't apply any retraction on the hand, so the vein can roll from side to side, and it will be difficult for you to insert the IV cannulation correctly, and therefore the vein will rupture or is well, causing difficulty for you to perform the procedure. So then what you do, another important you need to consider is that, so make sure you get the size of the cannula, then you have to compare the size of the cannula and the size of the vein. So in this case, when you see this, the size of this vein, I can use both the 22 gauge cannula or the 24 gauge cannula, but let me use the 24 gauge cannula. So what you do, make sure you get an alcohol swabs. You get an alcohol swabs, make sure you clean the vein first. So ensure you clean the vein first with an alcohol swabs. Then you allow the skin to dry first. You get the IV cannula. You remove the cannula from the packaging. Make sure you attach and secure the cannula first. You remove the cap of the needle. So this is how you are going to perform. So before you start, make sure you measure the length of the vein and the length of the cannula. So you have to match the length of the cannula and the length of the vein for you to insert at the correct depth. So this is how you are going to perform. Make sure you insert to 15 to 45 degree angle into the vein. Then what you do, you apply pressure. You will see a flashback in the jump of the cannula. You pull back the needle. Then you will see a secondary flashback. Then you advance the cannula deep into the vein. So this is how you are going to perform. So let us proceed. I hope you can see there is a flashback in the jump of the cannula. Then what you do, you pull back the needle slowly. So you will experience a secondary flashback. Then you advance the cannula deep into the vein. You release the TNQ. Then you remove the cap of the cannula. Then what you do, you apply pressure on the tip of the vein. You completely remove the needle. Then you cap the cannula now. Then what you do, you start dressing the cannula now. You get the adhesive tape. So this is how you are going to dress the cannula. You get a second adhesive tape. So this is how you are going to dress the cannula. Then what you do, make sure you flush the cannula first before you start administering the drug to the patient. Okay, now you have to flush the cannula. You get the syringe. You remove the syringe from the packaging. You get a 21 gauge needle. You remove it from the packaging. Then you attach the syringe. Then what you do, you get a sterile water for injection. In this case, I'm going to use the dextrose 5%. Then what you do, you flush the cannula now. So you apply pressure on the tip of the vein. You remove the cap of the cannula. So you insert the syringe into the cannula. So you start flushing the cannula now. When you finish, you remove the syringe from the cannula. Then you cap the cannula again. So this is how you are going to perform. When you finish, make sure you have to label the cannula on the date in which you have performed the IV insertion. So today is day 12, October 2025. Make sure you label. Then you can change the cannula after every 3 days. So this is how you are going to perform IV cannulation. Thanks for your watching. See you in the next video.